today's post, we're going to be talking about migraine headaches and the relationship that those headaches have to both the neurological controls in your brain, as well as some things that can influence your migraines metabolically or chemically, if you want to look at it that way. But from a neurological perspective, and as working from a perspective of functional neurology, you really have to look at the brain and how it's functioning. So in the brain, there's a part of the brain called the hypothalamus, and it's the headwaters to your stress system. And the autonomic nerve system is being controlled from this hypothalamic area. And the autonomic nerve system really has two sides. It has a sympathetic and parasympathetic side, and one is a fight or flight side, or the stress side, and then the other side, the parasympathetic side, is the rest and recovery and digestive type processes in your body. But if there's an overfiring or an escape of what is called the IML in the spine, the intermediolateral nucleus of your spinal cord, is the area of the sympathetic controls, these fight or flight controls. And what can happen is, if there's too much of this firing going on in that area, it can start to constrict the vessels so that blood flow can be altered to the brain, starting and initiating this migraine. So as opposed to just taking a medication which may get rid of the pain, or injectables or other types of things that you've been dealing with and how you've been treating your migraine, has your nervous system in this autonomic system been assessed? And it can be assessed and looked at from a viewpoint of trying to find out how you can modulate it to help your nervous system work better, so that it's not causing alterations in how these vessels get constricted and dilated. So just remember that, a migraine is a vascular headache, but those vessels are being controlled by nerves that open or close these vessels. So if that part of that nerve control is not allowing the vessels to open and close appropriately, then it can lead to migraine headaches. Now, from the metabolic side, the chemistry side, there's been correlations between certain types of food sensitivities, particularly gluten, and the presence of migraine headaches. So maybe you've been tested for gluten in the past and they told you everything's okay. You should look for my other posts on how I break down gluten testing and how it's very limited in mainstream healthcare, how they look for gluten sensitivity. But just know there is a component of gluten called prodynorphin. Pro meaning promoting, dyn, D-Y-N, promoting pain, dynorphin. There's a component of gluten that can be looked at called prodynorphin that actually has a relationship to headaches. So you could be eating certain foods that are promoting your headaches also, because they're inflaming the body, and with inflammation you're going to get an activation of this autonomic nerve system, because that's the stress system, or the place that stress is being controlled from, this autonomic place in your brain called the hypothalamus. So just know you can have neurological causes to your migraines, and you could have metabolic causes to your migraines. So you need to find a doctor that understands both these, as well as have a doctor who can work on both these areas. So from a functional neurological perspective, or from a functional medicine perspective, we can actually address headaches, and particularly migraine headaches, because they are vascular in nature. But remember, those vessels are being controlled by the nerve system being controlled by what stress goes into the system. So if there's lots of stress in the system, whether it be physical, chemical, or emotional, you can alter how that system works, and then alter whether you're going to have these headaches get better or not. So I'd like to thank you for watching, and make it a great day.